When will the COVID-19 pandemic end? Will the pandemic end because vaccinations will soon get us to herd immunity? Will strict COVID measures be imposed until the COVID cases decrease to zero? Or will the future pandemic shift to endemic?
How did we get here? Back in January 2020, COVID-19 started spreading from Wuhan, China, and then to across the world. On March 11, 2020, WHO declared that COVID-19 had gone from epidemic to pandemic. Now, COVID-19 has lasted for almost 2 years. Many are hoping to go back to a normal life. An option is an endemic framework, where people coexist with the virus. Vaccination rates are an important indicator for measuring if it is possible to transition to this. One definition of endemic is where a disease is prevalent in many regions, but the severity of its symptoms is low. An endemic framework has many parts that render the disease into a common one, like influenza. But what would that look like, and how will we know we are reaching it? We'll go over some metrics for that. For a start, one metric to look at is the current peak index. Here we see the rolling 7-day average of new cases compared to the peak, with some examples shown here. This is one barometer for the pressure on a nation's healthcare system. For those countries not at the peak, spare capacity exists, even if some of that comprises of temporary beds. A pillar of the endemic framework is monitoring the healthcare system load, where spare capacity can absorb the expected daily new infections.
But first, let's take a closer look at the current pandemic situation, with a specific focus on the United States, Singapore, and China. Cases per capita in the US remain high at more than 1 in 11, whereas the numbers in China and Singapore are much lower. The daily cases per million fluctuate at higher levels for the US and Singapore. In contrast, China's daily cases per million are much lower. The fatality rate in the US fluctuates at a higher number of 1.5%, while in Singapore and China, we see a lower percentage. Recently, we have seen spikes due to the Delta variant in Singapore and in China. Meanwhile, cases in the US are reducing compared to its peak. This might seem strange, but it could be because Singapore and China are stepping up COVID testing, as they're facing COVID outbreaks. Meanwhile, in the US, testing has reduced, so it is harder to track outbreaks. Now, when it comes to vaccination rates, we see high-income countries have much higher rates than low-income countries. In our case study, we have chosen 3 countries with relatively higher vaccination rates that are still climbing. Now that we have high vaccination rates, what strategies can be leveraged on to handle COVID? More specifically, which is better? An endemic strategy, like Singapore has chosen, or do we stick to zero COVID, following China's lead?
After the previous analysis, we conclude that when COVID-19 can truly be treated as an endemic like flu, we can say that COVID-19 comes to an end. Zero tolerance standard is not practical in the real world, and countries will all fall onto endemic policies sooner or later, based on the following reasons. First, in an economics perspective, endemic policy creates less financial burden to government finance than zero tolerance. Fund requirements will be overloaded implementing zero tolerance. Second, people need normal life even with the existence of COVID-19, making endemic policy a good choice for controlling the spread of virus and allowing softer restrictions on public daily life than the zero tolerance policy. Thirdly, evolving treatments secure this relatively safe status of coexisting with COVID. To date, 169 countries have provided vaccination support. The vaccination is very helpful in reducing the hospitalization rate and the death rate. Besides vaccination, there are collective efforts on inventing new medicines fighting the COVID, like what Merck and Pfizer do. Finally, consider nature of disease. We still see death from the influenza. Up until now, smallpox is the only infectious disease we have ever eliminated, so it's more likely for us to take the endemic view.
From the way we manage our borders to how we engage communities to be part of the solution, a measured multi-sector approach is central to the endemic effort. By coming together, we can find creative ways to restart the economy, protect the vulnerable, reunite families, guide government policy, and reconnect the world in a way that is responsible, safe, efficient, and inclusive.